Hi, I'm Nurse Carla.
Hi, I'm Naz Upani.
Hi, I'm Nurse Rana.
Hi, this is Nurse Gabby.
And this is Nurse Nikki. And this is the
Newbie Nurses Podcast.
So, on this podcast, we read case studies sent in by fellow nurses. We read over the case studies, read their nursing assessments, and then we ask our listeners for input, feedback. What would you do differently? We have a little question and answer period at the end. So, we're going to start with our case study and then we'll get into it.
Okay. Brahim Pereira is a 80-year-old male from Sri Lanka that immigrated to Canada with his family at age 22. He preferred to address Bob, a nickname given to him by co-workers shortly after moving to Canada. After death of his wife 6 months ago, he moved from Edmonton to Cold Lake. Now he lives with his daughter, son-in-law, and two grandchildren. His adult son lives out of town and has limited involvement in his care. Bob has a strong connection to his Muslim faith and prays twice a day and attends mosque with his daughter in Cold Lake every day. Bob views health holistically, incorporating spiritual, physical, and mental well-being into his life. Bob has been experiencing some bout of depression since his wife passed, but stated, "Staying connected to my faith helped me cope better with my wife passing." He doesn't smoke, drink, or take illicit drugs due to his religious beliefs. Mr. Pereira is still able to perform his daily activities of daily livings with little to no assistance. He walks to mosque every day to ensure he still get exercises. Bob stated that he doesn't always eat well and usually has one full meal a day with snacks. Bob enjoys spending time watching movies and playing cards with his grandchildren. Bob has a family history of heart disease on his mother's side, and in 2019 he was diagnosed with chronic heart failure. Bob doesn't have any allergies or other relevant health history. Today, Bob has presented to the ER with shortness of breath and swelling in his leg. He explains that it feels like I just can't catch my breath, even if I'm not moving about. My legs feel a little heavy too, and my socks keep leaving marks. Bob also explained that he stopped taking his prescribed furosemide because he was up all night needing to the washroom. He appears to be his stated age but look fatigued and anxious. So we took his vital signs. These are his vital signs. Temperature is 36.9 Celsius and his blood pressure is 152/90 milliliters per mercury, and his respiratory rate is 26 per minute and heart rate is 2000 beats per minute. um, Oxygen rate is 92 on room air, and his height is 175 centimeters and his weight is 59.8 kilograms.
Okay, Bob, I'm just going to ask you some questions about your health history. So I understand that you've been feeling short of breath. When did that begin?
It started like 3 days ago, and it feels like it's getting worse. I feel like I just can't catch my breath.
Is it constant or does it come and go?
Well, I first noticed it while I was walking to the mosque with my daughter. We had to walk very slow and take breaks. It got better when we stopped, but now it's constant.
How is it while trying to sleep at night? Do you find yourself needing extra pillows to sit up?
The first night I did use 2 extra pillows and it helped a little. The past 2 days, even with extra pillows, it's been so difficult to sleep. I am not feeling well rested in the morning.
Okay. Do you smoke, use cannabis, or drink alcohol?
No, I never had, for religious reasons, of course.
Are you experiencing any chest pain with the shortness of breath?
It's not pain, it's like, but my chest feels tight.
Okay. Can you rate that tightness on a scale of 0 to 10, with 10 being unbearable?
Right now, it's about a 4.
Do you have a cough because of your shortness of breath?
I do have a bit of a cough, yeah.
Are you taking any medications?
Yes, I take Lasix, metoprolol, lisinopril, and aspirin.
Okay. And do you take them all as prescribed?
Yes, I take them all. Well, except my LASIK, they told me to take it in the morning, first thing, but it's too many pills for me that early, so I take it with my lunch. It has me up all night needing to use the washroom, so I stopped taking it.
When did you stop taking the Lasix?
About 4 days ago, right before I started feeling short of breath.
And you said you've noticed some swelling in both of your legs. Can you tell me when that started?
Yeah, I noticed it in the last day I attended the mosque. So, 2 days ago. After our walk home, my legs felt quite sore and tight. I went home to elevate them, but it doesn't seem to be helping any.
Okay. The shortness of breath and swelling has prevented you from going to pray at the mosque. Is that correct?
Yes, I normally go every day, but I am too out of breath to walk, and my legs hurt too much to kneel and pray. I've tried praying from a comfortable chair at home, but it's not the same for me.
Is there anything else you would like me to know? For example, any allergies you may have, any cultural considerations for your healthcare team to be aware of, or other past medical history?
I don't have any allergies, but I would like a chair in my room to do my prayers, and I don't think I have any other important past medical concerns. I was pretty healthy most of my life.
Okay.
Okay, so now we are going to discuss the assessment that the nurse in this case performed on her patient, starting with general survey. So the nurse assesses the patient from her first interaction. The nurse documented that the patient appears his stated age. His skin color and tone are even and appropriate for his genetic background. He appears to be fatigued, anxious, and struggling to catch his breath. He walks slightly hunched over, slowly, and with a small shuffle. He appears to have adequate range of motion for his age. His speech is clear, and he responds appropriately to questions. The rationale for these assessments: performing a general survey on a patient from the moment you see them can tell you a lot about their health. Paying close attention to mobility, physical appearance, behavior, and structure. This is the start to any health assessment. Next, the nurse is going to start her head-to-toe assessment with a focus on lung and cardiac. The nurse performs a full set of vitals on the patient and documents his vitals as a temperature of 36.9. His blood pressure is at 152/90. His respiratory rate is 26 beats a minute. Heart rate is 120. SpO2 is 92% on room air. His current height is 175 centimeters, and his weight is 59.8 kilograms. The rationale for these assessments: the patient is in noticeable discomfort and has stated that he has chronic heart failure, swelling in his legs, and shortness of breath. The nurse should start any assessment with vitals. In this case, it's important if the nurse is suspecting fluid overload due to abrupt changes in his medication, with special note on his weight. After obtaining the full health history questions, which we just discussed, the nurse is going to focus on the heart and lungs. The nurse has performed the following assessments, and these are her findings. The patient can maintain good eye contact, and his eyes appear to be free of swelling, redness, or lesions. The patient looked fatigued with small dark circles under the eyes bilaterally. He wears prescribed glasses, but his pupils were equal, round, and reactive to light and accommodation. The patient had no signs of pain, swelling, lesions, lumps, or rashes upon inspection and palpation of the head and face. His ears were free of redness, drainage, or swelling, and there was a small amount of cerumen in the ears bilaterally. The patient's mouth and tongue were moist, pink, with no signs of pallor or cyanosis, and he had adequate dental hygiene and does not wear dentures. The rationale for these assessments: the patient stated that he's been feeling depressed and does not always eat well. He's also experiencing shortness of breath. Assessing the head and face and mouth would determine any signs of poor dental hygiene as a possible symptom of his depression, inadequate fluid intake, or signs that there is not enough oxygen circulating through the blood. The nurse palpated and auscultated the carotid artery bilaterally. The patient's pulse was 120 beats a minute, regular with moderate strength. There was no presence of bruits. The rationale: in older patients, hearing a bruit in the carotid artery can indicate narrowing of the arteries. The nurse is investigating if this patient's heart or lungs is causing the immediate concern. Next, the nurse will examine the upper extremities and notes the following findings. The skin was warm to touch, dry, and appropriate color for the patient's genetic background. There were no signs of lesions, cyanosis, rashes, or bruising. There are no signs of edema in the arms. The cap refill was less than 2 seconds bilaterally, and the patient's radial pulses were 2+ bilaterally. The rationale for these assessments: the patient is experiencing shortness of breath and has chronic heart failure. He stopped taking his diuretic. The nurse is looking for signs of fluid overload or decreased cardiac output. The nurse performed an inspection with palpation on the chest and found no lumps, lesions, rashes, and the patient denied any pain during this assessment. The nurse auscultated in the ape-to-man fashion and found no signs of bruit. The heart rhythm was normal and rate was 120 beats per minute. Only S1 and S2 sounds were heard. The rationale for these assessments: the nurse is investigating if the patient is experiencing fluid overload or if the concern is his heart. The sound of bruits or irregular heart sounds would indicate that it is heart and not the lungs. Next, the nurse auscultated both the anterior and posterior chest for lung sounds. Upon auscultation, the nurse noted adventitious sounds bilaterally. The nurse described the sound as fine crackles, possibly coarse crackles. During the assessment of the abdomen, there was a normal contour noted, no lesions, dissension, masses, and bowel sounds were hypoactive in all 4 quadrants. The patient denied any pain during palpation. The rationale for these assessments: the presence of any adventitious sounds in the lungs could indicate pulmonary edema for this patient. The nurse is looking for anything that may be causing him pain and looking for signs of swelling and fluid overload like edema. And for the nurse's last assessment, she's going to assess the patient's legs and feet. The nurse documented bilateral lower extremities are symmetric, with 2+ pitting edema noted at the ankles and lower legs. The skin was warm and intact without lesions. Capillary refill was greater than 3 seconds bilaterally on the feet. Pedal pulses were 1+ and equal with regular rhythm bilaterally. An appropriate strength in the dorsiflexion of the feet bilaterally was noted. Rationale: the patient is complaining of heavy swollen legs with sock marks being left behind. The nurse is assessing for edema in the legs and feet.
Now time for that S-bar call. Excuse me. Hi, Dr. McDreamy. This is Carla. I'm a nurse from Portage College. I have Mr. Pereira here, an 80-year-old male that was brought into the hospital with shortness of breath and swelling in his legs. He was diagnosed with chronic heart failure in 2019 and is currently managing his condition with aspirin, furosemide, metoprolol, and lisinopril.
Okay, Nurse Carla, so what meds has he received recently?
He's been taking everything, but he did report he had stopped taking his furosemide 3 days ago due to nocturia and denies any chest pain currently.
Okay, thank you. So, what are the current vital signs?
His vitals are his temperature is 36.9 degrees Celsius, blood pressure is 152 over 90, his respiratory rate is 26 breaths per minute, and his heart rate is 120 beats per minute. His O2 stat is 92 on room air. Mr. Pereira is 175 centimeters tall, and he weighs 59.8 kgs. Upon assessment, I've confirmed that he has 2+ moderate pitting edema bilaterally in the legs, and his cap refill on feet is less than 3 seconds bilaterally. S1 and S2 sounds are heard with no extra beats or murmurs. There was, however, fine crackles on the anterior and posterior chest during lung osculation.
Okay, so any recent procedures, labs, or imaging?
No, he has not had any of that. There are signs of cyanosis, but he does appear fatigued and anxious. I recommend a chest x-ray to evaluate for pulmonary edema, labs including BNP and BMP and an EKG. Given his fluid overload and recent discontinuation of furosemide, I suggest restarting diuretic therapy and getting him on oxygen. I will begin a strict intake and output monitoring and daily weights. Would you like me to move ahead with those tests, doctor?
Of course, Nurse Carla.
Thank you so much. I will begin that.
Okay, guys, so that is our podcast episode. And as fellow nurses listening in, we want to know your thoughts. Did the nurse perform all the appropriate assessments? What would you have done differently? What do you think is going on with Bob? So we want you to write in with all your questions, and we will respond. And thank you for listening to the Newbie Nurses